Our SmART group members include Freda, Keegan, and yours truly, Emmanuel. So for today, we are going to conduct a mini nursing competition between two esteemed and hardworking nursing students. The students will be judged and evaluated based on their ability to tackle the PICO question of the assigned quantitative study. The question is, within the elderly population of 60 years or older and during the administration of subcutaneous heparin, is a conventional injection or a modified injection method paired with hot compress more effective in reducing pain, bleeding incidents, and bruising or hemorrhage in the injection site? The competition will now commence.
After performing hand hygiene, I don a new pair of gloves. I then take an alcohol wipe and clean the top of the low molecular weight heparin ampule. And then set the ampule aside and open a new subcutaneous needle. I drop 5,000 units of heparin. Once the heparin is drawn up, I can recap the needle using one hand and set it aside. I then wipe down the patient's arm with another alcohol pad and wait for the injection site to dry fully. Once the area is dry, I uncap my needle and expel any air that is in the needle tubing. Then I tighten the area around the skin with my left hand and insert the needle with the bevel pointed up at a 30 to 40 degree angle. Once the needle is inserted about 2/3 the length of the needle stem, I pull back and observe for any blood entering the syringe. If no blood is observed, I continue with injecting the heparin. Once done, I remove the needle, I recap the needle, and I apply pressure with a cotton swab for 2 to 3 minutes.
Hi, my name is Freda, and I'm going to be doing the low molecular weight heparin injection using the modified technique with the hot compress. So first I'm going to wash my hands and sanitize them. I'm going to don my gloves. Then I'm going to take my alcohol swab. I'm going to disinfect and clean the area. Then I'm going to take my hot compress and I'm going to apply it for 3 to 5 minutes. I'm going to open my needle and my syringe. I'm going to cap it. I'm going to take another one. Oops. I'm going to clean the port. Then I'm going to uncap my needle. I'm going to drop air. I'm going to inject it. Squeeze the air in there. And then take out how much I need. Then I'm going to set that to the side. So I'm going to open my new needle, take this one off, attach my syringe to the new needle, keep that there. I'm going to take off the hot compress, then I'm going to massage the area, then I'm going to take an alcohol swab, disinfect the area again. So I'm going to pinch it. I'm going to put the needle in. I'm going to take up, aspirate a little bit. If there's no blood, then I'm going to inject the low molecular weight heparin. And then after it's done, I'm going to slowly inject it for like 10 to 15 seconds. After it's done, I'm going to keep holding it pinched for a little while. And then I'm going to let go, and I'm not going to apply any pressure. And that's the injection method. My method is backed up by a good quantitative study. The p-value is less than 0.05, which means the null hypothesis is rejected. The data collection method used in this type of study provided us with specific data. The method of data collection was descriptive enough to where I was able to reproduce the study. There was less bruising, less pain, and less bleeding seen with the modified method.
Now, it is time for me to decide on the winner for a nursing competition. The study is a randomized controlled trial consisting of a sample size of 260 patients with specific coagulation disorders. The sample size was appropriate and results were comparable. Inclusion criteria for the study consisted of individuals between 60 to 85 years old who are alert, have normal skin integrity, so no abdominal skin diseases, ecchymosis or induration, and have normal blood lab findings, normal PBT and platelet count. Patients were then asked to sign an informed consent and later approved by the ethics committee of the study's hospital. The literature review was informative and related to the objective of the study, which was to decrease subcutaneous bleeding and pain. The literature review discussed the following: the importance of low molecular weight heparin administration and its development, the methods of injection and current use, and the negative patient outcomes that tend to occur upon subcutaneous injections, which includes psychological burden affecting nursing quality and treatment compliance of the elderly. The dependent variables of pain and bleeding were assessed based on a numerical severity scale between mild, moderate, and severe. However, the data collection process was not stated. The results generally showed a decrease in bleeding incidence, pain at the injection site, and bleeding severity within individuals that received a modified injection of heparin compared to those that received the conventional method. The winner for remaining nursing competition is Freda. So congratulations, Freda. The modified method of heparin subcutaneous administration showed an overall improvement in patient well-being. A decrease in subcutaneous bleeding and pain were seen with Freda's injection technique.